Hello, my name's Christine Eisenhauer, and I am a nurse scientist from Norfolk, Nebraska, and I work for the University of Nebraska Medical Center College of Nursing on our rural campus called the Northern Division. And I'm really excited about getting to introduce myself to you today, as well as having some future times to speak with you more about the specific type of research that I do called qualitative methods. I want to start my introduction with you today with a picture from a hilltop on the Santee Sioux Reservation where I live up by Center, Nebraska. My husband and I have a large cattle ranch up there, and this is one of my favorite places to relax and just enjoy the beauty of Nebraska. So as I talk to you more today, you'll find out more about me and my rural focus as a nurse scientist, and I'll share lots of photos with you as we move forward. So here you'll see is a picture of me and one of my baby calves on my cattle ranch. Our baby calves are born between February and April every year, and that's always my favorite time of year because I get to expand my nursing skills to help animals in addition to helping people. As far as where did I come along on this journey as a nurse to become a nurse scientist, I started off my journey actually working in rehabilitation nursing homes right when I finished my bachelor's degree, and I really was drawn to community public health nursing. I liked the idea of caring for groups of people. So at that time I went back and started working on my master's degree, and at the same time there became a job available where I live in Santee, where I was able to work for the village of Santee, helping the local community members that lived there. And so that was a wonderful opportunity to be able to practice public health nursing at the same time that I was learning it in school. That job that I was, when I was working there, was on a grant, and so when the grant was finished, the money ran out to pay for my job, and so it was time for me to look at something different, and that's when I got involved in academic nursing as an educator or a teacher. There was an opportunity to teach public health nursing at a local liberal arts college, and so I started doing that, which I really found that I enjoyed, and I've worked in education now for 18 years. As I was working as a teacher, I had an opportunity to get some extra training along the way in transcultural nursing and in as an academic nurse educator. And so these things kind of spurred me to continue to be a lifelong learner and just continue that journey. I really like learning new things. So it was kind of somewhere along that journey that I decided I wanted to go back and get my PhD. And this time I wanted to focus on rural nursing because rural is where I live. Rural are the people with whom I serve, my neighbors, my friends, my patients. And so it was really important for me to be able to do some further study specific to that area. So as far as my research interests, right now my current research is working with rural men, and I used a community engaged research, which is research when you work with communities and you find out what things they would like and how they would like it, and then we kind of design the research around them and their preferences and what they want to see, and then we work together as a team to see how what we've designed and developed worked. And so this study that I'm doing right now is done in Northeast Nebraska, and it's a clinical trial where we have two groups, and one group gets a certain type of treatment and another group gets another type of treatment, and then we compare them at the beginning, midway through, and at the end. And so in this study, the men are given an app and on their mobile phone, and they use that app and some other resources to monitor their eating and activity, and then we evaluate at the end which one worked the best in helping them to lose weight. So just some other fun facts. I've already told you where I live, but I bet you also didn't know that I keep 85 free-range chickens. So I really enjoy that as part of my hobby. So here's a picture that I want to show you and ask you to reflect. So you'll see this picture on the left is, a nurse probably in the 1930s to 40s, I would guess, and you can see how the environment looks pretty cold and sterile, very institutionalized. If you're a patient in a hospital such as this infant, things were very different back then than they are in present day when you see the picture on the right, where this mom is in this nice room that looks very much more homey. The nurse looks very much more personal and compassionate with the patient, and we know that today when women have their babies, they're able to even design their birth plan and to invite their families or friends or significant others to be with them to have that experience. And so I like this picture because it represents that culture, or the way, the norms of how things are, whether it be in nursing, in healthcare, in our community. It evolves and it changes over time. And so that has always been of great interest to me, the study of societies and groups of people, and how their preferences and life ways in some ways stay the same and in other ways change over time. And so that's just a picture to show you that was kind of some of the rationale for why I initially got interested as a nurse scientist, was that kind of underlying desire to want to study cultural change across time. As well as I was seeing cultural change within our College of Nursing. Just as I showed you that picture before of the nurse in the white uniform and the sterile environment, we've also seen evolution in how nurses training happens. And so here's a picture of some of our students on the Northern Division in their health assessment class. And this would be when they get their stethoscope and they learn how to listen to the heart and all those things that nurses do when they're checking a patient in and assessing them. And this is a technology called a HoloLens that allows the nurse to put this technology on, kind of like a visor over their eyes, and they're able to actually visualize the internal organs of the body from like a 360-degree view, so from every angle. And so to me, that's also another great example of how everything evolves and changes over time, including education. And here's an example of one thing that makes it much more fun and dynamic to learn this way than to learn in an old-fashioned 2D manner. And then this next picture I want to show you is a picture of a fairly new technology we have at our university called the eye wall. And you can see in the lower right that this computer is massive. It encompasses up a large entire room, and every one of those screens has kind of like multiple screens inside of it that are completely interactive. You can touch and you can bring up the web, you can play videos, you can be talking with somebody, you can be designing something, all simultaneously. And so you'll see the other three pictures there. The two on the top are of students who are learning about becoming nurse scientists and what you do in PhD school. And then the one on the lower left is of our nursing faculty learning about the eye wall and how we can incorporate that into our teaching. So those are two instances also that really are part of the intrigue for me as a nurse scientist, is to kind of look and embrace these technological changes and how they can help us in learning, how they can help our health, and how they can help us have a better experience with our healthcare system. So that's a summary of how I became interested in research. I've given you a little introduction into the current study that I am doing. I started my research with rural women, actually, and I did a form of research called ethnography, where it's the study of social lifeways and culture and how that particularly influences health and health behaviors. And after that initial study, then I adapted my study to focus on rural men, and that was directly driven by the local community, who told me that they really felt that there needed to be improved health and wellness options for rural men, because in many cases they're caretakers for the family. And so we need to have wellness options for them that can prevent disease and prevent other injuries and ailments. And so that's when I started my research with rural men, and the title of my current research study is called Engaging Rural Men with Mobile Technologies for Weight Loss, a randomized control trial. So I applied for some monies from NIH, the National Institutes of Health, and they gave me some financial support to be able to conduct this study over 3 years. And then we take those results and we publish them, and then try to replicate and adapt the study somewhat at a larger scale for the next study. And so some of these pictures I share with you are of actual participants in my study, but I do want you to know that these subjects have consented or given their permission written for me to use these pictures for purposes of education and for teaching about my study. So I am doing that with their explicit permission. So here you'll see a picture of Victor. He was our research nurse in our study. He was actually a community health worker at a local public health department, and so he really knew the community really well, had a lot of great relationships with people. They trusted him, and so Victor just made a wonderful person to be kind of the front line with the men in our study. And so we advertised on Facebook and through other media channels about our study, and that we were offering this weight loss study that used the Lose It app, which is a free app you can download on your phone, as well as one group of our men got a smart scale, which is just a scale that has Wi-Fi capabilities, so it syncs with your app. So when you weigh yourself in the morning, it will link up immediately to your app and help you stay on track. You know, did I gain a pound today or did I lose a pound today? As well as we also tracked the men's blood pressure and then gave them some general teaching about reading nutrition labels so they could help make better choices. And so that study lasted 3 months, where they tracked themselves very intensively for weight loss. They came in and were measured and had their weights checked and their blood pressure checked. And then for the next 3 months, we just encouraged them to continue to monitor their eating and activity and to see what would happen after that next 3 months. Did they maintain their weight loss? Did they gain some back? Did they continue to lose weight? And so that was the nature of this study. This study is just finished up. The men have completed, and now we are moving on to write up the findings of this and then be able to report this back to NIH regarding the findings. And so what makes this study particularly special is two things. One, of course, is that it's community driven. So that gives me assurance at night that this is something that the community indeed wants. We use a community advisory board of lay people and community leaders who we meet with regularly and help advise us. You know, would this be something the community would like? Would this be something the community wouldn't like? When the study was done, I also conducted focus groups with the study that helped them to help me to ascertain, you know, what does this mean? Why did some people participate in this and other people, nobody seemed to like this part of the study? Why was that? And then they can tell me more about it. And then also, studies of rural individuals in general, and especially rural men, are very far and few because it's expensive. It's difficult to recruit rural individuals into research because of our isolated geographic. Also, we tend to have less resources in rural areas, and so rural individuals or rural residents as a group, we are considered a hard to reach population for purposes of research. And it is important that we do research rural populations because we can't assume that the preferences and things that have been tested in urban areas that they work with rural people, because there's different resources, there's different cultural norms. Things are very different from each other, and so we really do need more rural research so that we can better inform processes and the way that healthcare is reimbursed to really reflect the needs of people in the rural areas. Also, one thing that's fun about the research that I do is it's community engaged. As I told you, all the different ways that I get involved with the community to try to learn from them on what they want and how they want the research conducted. But then there's always wonderful things that develop through the process of research that give back, provide sustainability to these communities even after my research is done. And that's really important to me, that what I do helps to give back to communities, doesn't just come in, kind of fly by the seat and then leave, but that we're actually doing things that help to provide infrastructure for communities long-standing. And so one thing that's developed through the process of my research is something called the Nebraska Obesity Coalition. So we have a group that gets together regularly that represents all different sectors, not just rural men, but children, school-aged, adolescents, young adults, middle-aged adults, elderly, and we have people that represent all of those individual groups who work with them in some way or fashion. And so we are working to try to kind of group and pool resources within our rural area so that we can best align services and resources that are really needed by those groups. We also have a second group that would be rural hospitals and rural clinics. And so this would be like the CEOs, administrators, directors of those area hospitals that we also have in a different grant that we got that helps us to develop ongoing health promotion programs that are accessible to the community. So we are most currently providing a weight loss program out of one of the rural hospitals that will be accessible to the community. They can come in and get training on how to use the application for their phone. They can come in and get weighed if they don't have a scale, and then we'll give them resources that help them to self-direct their eating and activity if weight loss is their goal. And so we also continue to work very hard once the research is done to make sure that what we've uncovered as the need for that community, that we do indeed at least start on developing and pooling those resources so that we can address that ongoing. So as far as future plans, where do I go from here? Well, I like this picture because it's a picture of one of the highways out where I live on the reservation, and you can see for miles, but yet you tend to go in a straight, the road tends to be straight. And so what does that mean? Well, you know, research really takes a lifetime. It's a trajectory that takes your entire career. It's not something you achieve in 1 or 2 studies. And so I like the analogy of this long highway because I'm on this journey and I know what direction I'm going, but it's also going to take me a long time to get there. And so in the next year, I'll be writing up the results of my studies, and we'll be communicating those with the National Institutes of Health as well as other publications, as well as with the local community. It's important for the community to know what we found. And then I'll be following up with a larger study that encompasses a larger section of rural Nebraska. And instead of using 2 groups, I'll be adapting or advancing my research to try a few more things with the weight loss app and the SMART scale that you saw that were based on the preferences that we learned from the men this time. So in other words, we're kind of enhancing the intervention with more of the bells and whistles and specifications that we learned from the men this time, and then we're going to test that in different forms to see which combination of these different elements. Is it the app only? Is it the app with the scale? Is it the app with the scale with some type of guys, maybe social support group? Which one of these combinations of interventions really works the best? Which one results in the best weight loss and the best satisfaction? So stay tuned. That will be the next study. So thanks for this time to introduce myself to you, and I look forward to talking to you more when we speak more about what is qualitative methods. Thanks.